Hey guys, welcome back to the channel. Today we're going to be talking about acne scars, and one of the reasons that I'm covering this topic, of course, a lot of reasons actually, dermatology, we deal with them all the time, but this is one of the topics that I get more questions about than almost any other. Acne is such a universal condition that affects so many people that acne scars then follow along with that. So we're going to talk about what it is, how to treat it, and the reason in particular that we're covering this topic today is because recently there was a consensus statement put out by some of the world experts in treating acne scars. We're going to review what their recommendations were, and I'm going to give you my thoughts on that. The whole reason that we do this is to help improve your visits with your dermatologist, so you know what kind of questions to ask, to save you money, to help you get the right treatment earlier on, and help you feel more comfortable and confident in the treatment that you're getting. As always, I love answering your questions, so make sure you put them in the comments. Let's jump into the consensus statement. Let's learn a little bit about the experts and what they recommended in the treatment of acne scars. So we're going to be reviewing this international consensus statement today from experts who treat acne scars all the time, kind of learn what they said. And I'm going to tell you a little bit about what a consensus statement is. This is also all going to be available on the podcast feed, so you can listen to it while driving. But a consensus statement is something that takes what all of the experts are saying around the world and kind of allows them to interject with their experience, with the data that they're aware of. And this is done on complicated topics, sometimes on topics where there's not a ton of published data to really determine what is better than another thing. So we're using the experience of experts and what their recommendations are to hopefully provide you with information and to provide other doctors with information as we make recommendations to our patients. So this consensus statement was from 24 dermatologists and plastic surgeons who routinely treat acne scars, and we're going to kind of see what they said. This article popped up for me in Dermatology Times, and I'm going to leave that in the video description or in the podcast show notes so that you can take a look at this article if you want. You can also find in that the full article, the full paper that was published, so you can read it unfiltered by editors or by me if you'd like to see what the experts recommended in the treatment of acne scars. That'll be in the video description as well. So these experts were looking at primarily energy-based devices in the treatment of acne scars. So energy-based devices are primarily going to be things like lasers. Lasers are not the only thing that can treat acne scars though, and the type of treatment may depend upon the type of scars that you have. We know that people can get what we call rolling or boxcar scars. These may be broad, they may have kind of sloping edges to them, but we also see things like ice pick scars. Ice pick scars are very, very small and very deep, kind of like the name implies, like you were poked with an ice pick and you have a long, kind of deep scar going down into the skin. One of the most effective treatments for that, in my opinion, is going to be a really strong chemical peel dropped right into the middle of that. That procedure is called TCA cross, or trichloroacetic acid. That's the acid that I use and that has been published. And CROSS stands for the Cutaneous Revision of Surgical Scars, so CROSS. Now, TCA cross can be employed to treat surgical scars, so if it doesn't look beautiful after you've had a surgery, it has to be done in the hands of a professional. This is definitely not the thing to do at home. Also, it can be done for ice pick scars following acne. The authors of this study primarily looked at energy-based devices in the treatment, so these are going to be lasers. We're going to talk about the first category of lasers, ablative fractionated lasers. Ablative lasers are ones that completely remove everything in their path. So most of the time we're going to be talking about devices like a CO2 laser or an erbium laser. These target water in the skin, and we have a lot of water in our cells. So as these lasers hit, they vaporize water, and so it hits the epidermis and the dermis to kind of vaporize things. And the wavelength at which these lasers fire are particularly attuned for water. Erbium has even more attraction to water than CO2, but it generates less heat because of that. So we're going to be talking about these two types of fractionated lasers and what the experts recommended. I have both a CO2 and an erbium laser, and I like using both of them. I feel like the risk of pigmentation changes is just a little bit higher when using a CO2 laser, so that may not be most appropriate to darker skin types. In this consensus statement, 47% of the panelists indicated that fractionated CO2 laser is more effective than the fractionated erbium laser for acne scarring. 8% thought that it was the opposite, that erbium was better, and the remainder thought that more research would be needed to really make a determination if erbium or CO2 was better. This is something that you're really going to have to be trusting of your doctor You know, I have both treatment modalities available, and depending on the patient, their skin type, what the scar looks like, I do use one versus another, and I can't tell you without looking at your skin which one I would recommend for you. And so this is the judgment of the physician making that treatment. If I only had a CO2 or if I only had an erbium, that's what I would use in many types of acne scarring, but there would be some patients who it might not be appropriate for. And I think one of the things that sets dermatologists and plastic surgeons apart over somebody who wasn't primarily trained in treating cosmetic indications like acne scarring is just knowing when to say no, that something is not right. And so if your doctor is really well trained, they should be able to say this isn't right for you if it's an inappropriate modality, whereas somebody who may not have the same ethics could just take your money and try something. And I've unfortunately seen things like that happen with laser tattoo removal, you know, from an inappropriate laser. Or acne scar treatments or chemical peels, something that just wasn't going to fix the problem that the patient was coming in there for. So most of the panelists, 65% of them, felt that ablative fractionated lasers were best to treat, you know, superficial and rolling boxcar acne scars, while the remainder of the panel, 8%, indicated that non-ablative fractionated lasers might actually be better. So let's talk about what that means. Non-ablative fractionated lasers will actually pass through the epidermis and go down into the dermis where they'll heat the tissue, because they're not charring the epidermis, they're not making a superficial injury. You don't necessarily see that on the surface of the skin. With non-ablative lasers, the downtime may be less and you may need more treatments in order to get the result that you're looking for. Most of the panelists in this study believed that 2 to 4 treatments with an ablative fractionated laser was needed in order to get the type of results that a patient was looking for. And that is one thing that I try to set the expectation for with my patients when I am doing a consult for the treatment of acne scars, is that it is going to take several treatments in order to improve acne scars, or really any type of scars for that matter. Is these things are very complex, the collagen is disordered under the skin, and it takes multiple treatments to break up that scar tissue and help to promote new healthy scar tissue growth. When it comes to how frequently should you space those treatments apart, most of the experts here recommended waiting between 2 and 3 months in order to let one treatment really take the full effect before moving on to a second treatment. It can take time for the body to produce new collagen, and so that is something that I typically make my patients. I like to have them wait at least 6 weeks between their treatments in order to make sure we're getting the maximum benefit from the previous treatment before we start hitting the skin again. Some panelists did believe that 1 month was sufficient, and some of the panelists, even 21%, thought waiting 4 to 6 months was the most appropriate interval between those. 4 to 6 months would be great, but I find that most people are just not that patient and they want their acne scars gone ASAP. And so treating every 6 weeks kind of is where I land on mine with my patients. I feel like we get a good balance between letting the last treatment kick in and then also delivering results in a timely manner for the patient. The other treatment modality that was explored was the non-ablative fractionated lasers. We've touched on those just a little bit. These are going to be things like erbium glass and fiber lasers. And again, they're not doing damage to the epidermis. They're passing through the top layer of skin before they're causing their heat. And these can be really good because they have less downtime. That downtime may be 1 or 2 days, whereas an aggressive fractionated ablative laser, like we talked about before, could take 1 to 2 weeks of downtime depending on how aggressive you are, how deep you tell the laser to go in the skin, and how close together all the little columns of laser energy are. Because we space them out. It's kind of like aerating your lawn. We have little injuries to the skin, but we space it out by leaving normal skin between the areas of energy. That's what a fractionated laser is. That allows you to heal faster and less risk of complications. And I find that they're much better for the treatment of acne scars. I think using a fully ablative laser, think of that as mowing the grass, just taking everything off the top. I don't really love that application for acne scars because acne scars sometimes get wider as you go down, so I don't like mowing off the top layer of skin. Fractionated, non-ablative lasers pass through the skin, but they're also spaced out. So you have small areas of injury, but you have areas of normal skin, which helps to facilitate healing much quicker. Among the experts in this panel, they recommended waiting only a month between non-ablative fractionated lasers. Again, because the downtime is less, you can probably move on and treat a little bit more quickly because you're going to be healed up within a couple days and you're going to be producing that collagen a little bit more quickly than something that is more aggressive like a fractionated ablative laser treatment. Another device that was in this consensus statement are vascular lasers. Now, scars are texture changes in the skin, and sometimes those texture changes are accompanied with pigment changes or redness or erythema left in the skin. We call that post-inflammatory hyperpigmentation. And those can be treated with vascular lasers, and that also can induce some collagen remodeling in the skin, which can help with texture, but many people may not have texture and they just have discoloration to the skin, and using lasers that target hemoglobin in the skin or blood can help to get rid of some of that inflammatory pigment change. So some of these lasers are going to be things like a pulsed dye laser. I have one of those in my clinic. It's at 595 nanometers, so it targets hemoglobin, and that can really help to take away redness, extra blood vessels, and sometimes those are associated with scars. The experts recommended multiple treatments when it came to pulsed dye laser or other types of vascular laser because, again, these things take time. We're going to get an incremental improvement with each treatment, and we can't be too aggressive or it can risk burning the patient, and then we're starting all over with a new scar. Vascular lasers have been really popular for a long time, and now on the market we have things like picosecond lasers. Picosecond lasers have revolutionized the treatment of tattoos for tattoo removal because they fire so quickly. We're talking about picoseconds, that's literally in the definition of the type of laser, whereas something like a Q-switch laser is on for nanoseconds, which in the grand scheme of things is still really short, but so much longer than picosecond. This is why this matters. Picosecond lasers can deliver their energy so quickly that it doesn't heat the surrounding tissue. It's really good to help break up pigment and not induce heat, which may lead to other pigment changes, especially in darker skin types. Once again, the picosecond lasers can be very effective in helping to treat inflammatory pigment change associated with acne scars. Lasers are well known, and the panelists indicated that they were most comfortable and most familiar with using lasers in the treatment of acne scars, but a new method of treatment has come onto the market over the last few years, and that's radiofrequency. So fractionated radiofrequency or radiofrequency microneedling has become increasingly popular. Many people are familiar with microneedling or microchanneling, which uses a device to create multiple injuries in the skin with tiny little needles that may go anywhere between a half a millimeter up to 3 millimeters into the skin. This can produce bleeding and can help to induce new collagen growth in the skin. Radiofrequency microneedling takes a device like that with tiny little needles, and then they go into your skin and pass a radiofrequency current between the needles, which creates heat in the tissue, and that can help to generate collagen and remodel those scars, break up some of that bad collagen that is causing the scar appearance. So fractionated radiofrequency or radiofrequency microneedling has a promising future in the treatment of acne scars, but overall the panelists didn't have as much experience using those kinds of devices. Radiofrequency microneedling does have some promise, and I do think that regular microneedling without radiofrequency does have a role as well for mild acne scarring. Really deep rolling, scars from cystic acne, you may not see the results, and that was something that the panelists agreed with, that microneedling without radiofrequency doesn't have the same kind of results that some of these other energy-based devices have. Knowing some of these things, let's jump into some of the conclusions of the paper and see what overall these panelists do in their practices and how that might help you as you look for treatments for acne scars. So first, most of the panelists, that's 95% of them, recommended multiple treatment modalities. So there's no gold standard, there's no cookie cutter cookbook version of this is the thing, everybody does it, your acne scars are going to get better. You often have to use multiple different modalities, so you may need ablative fractionated treatments and combine that with radiofrequency microneedling. You may need to combine it with non-ablative fractionated laser. There's different things, but usually you're going to get the best results when combining multiple modalities in the hands of somebody with good experience treating acne scars. Some of these multiple treatment modalities include things like the TCA cross that we've talked about, and they can also include things like subcision. So for really tethered down scars, sometimes we actually have to make an incision in the skin to go down and kind of loose up that tethering band that's pulling the scar down. And then we can move on to energy-based devices like lasers or chemical peels. Additionally, there may be a role for things like fillers in the treatment of acne scars. So there are some fillers that help to stimulate new collagen growth, and there are some fillers that are just really going to plump up the skin, like the hyaluronic acid type fillers. And that's going to be a conversation that each person needs to have with their provider to determine what is going to be the most appropriate. These biostimulatory fillers, things like Sculptra or Benefil, these are going to actually help your body to create new collagen and can be considered somewhat permanent in the reduction of acne scars. But all of these do have the potential for complications, so permanent fillers, if they go wrong, you're looking at way different ways to treat those and much more long-term implications. So again, very technical. One last caveat of treatment with acne scars we've touched on a little bit is skin of color. So anybody with a darker skin type needs to be very cautious. I recommend having all of the treatments done with somebody very familiar with treating skin of color because the risks are much higher. A lot of these energy-based devices can cause more severe pigment change if you're not doing it appropriately. That's energy settings, that's the laser type or the device type. So that's something to be very careful with. You never want to pursue a treatment and then have it end up even worse than where you started. One thing I really like about the consensus statement, now that we've reviewed some of the options for the treatment of acne scars, is that they include several case reports. So if you wanted to check out the paper, you can go to that link and you can look at the pictures of these people before. You can see what the experts did to treat them and then how they ended up. So I find that really helpful as a practitioner because I can not only read all the recommendations, but then I can look at these examples and actually, think of patients that may look very similar to that, their skin type, the type of acne scarring, and then make sure that I'm getting them the right treatment. The treatment of acne scars is very complex and there's many different modalities that can be used to treat that. I hope overall you found this helpful so that when you go to seek out treatment with a dermatologist or a plastic surgeon, you know maybe what kind of questions to ask, or you at least understand the jargon, the lingo a little bit better when they're talking about an erbium laser or a CO2 laser or radio frequency microneedling. You can be able to make a more informed decision to know what's going to be right for your skin and be able to get those acne scars better in a short amount of time. Again, if you're suffering with acne scars, there are not a lot of over-the-counter treatments that can help with those. I do recommend a retinol. You can do light exfoliation with glycolic acid, lactic acid, but the strengths that you can get over the counter are really not going to do a ton for true scarring. If you have post-inflammatory pigment change, they may be helpful for that. So I do recommend making sure you understand what type of acne scars or pigment change you have so that you're getting the right thing over the counter and then combining that with treatments in an office setting. If you guys have additional questions about the treatment of acne scars, make sure to leave them in the comments below. I'm also going to be doing an AMA episode all about acne scars, so you can look for that later in the week. That one is going to cover some of the questions that I've gotten off social media or that I see down in the comments of this video. So hopefully I'll be able to provide answers to you. Thanks again for following along with the channel. I want you to share the video with somebody. Make sure you're subscribed, and I'll look forward to seeing you next time.